Holy month of Ramadan is just about to begin, and plenty many Muslim brothers and sisters will be observing fast during this religious month. However, during this month, it is very important for you to take care of your thyroid health. And if you don't take your thyroid medications in the right way, it is going to negatively impact your thyroid. How to do that and what all precautions you need to keep in mind, especially when you're going to observe fast during this month, that's what we are going to learn in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Holy month of Ramadan is just about to begin. And during this period, your eating habits change, your physical activity, your sleep habits, everything changes. And that can have impact on your thyroid health. Prior to this, you may have come across a lot of information about diabetes and Ramadan. But very few people actually talk about Ramadan and thyroid, which is also very important. As the diabetes people are increasing, the people suffering from thyroid health problem is also quite a lot. And that is the reason why it becomes very important for you to empower yourself with the right knowledge so that you can reduce fluctuations of your thyroid. Now you must be wondering what will happen if there are fluctuations in thyroid. Well, it can have a lot of negative impact. The impact can also go all the way up to your heart. And that's why today's video is a very vital. Okay. So let's discuss about the thyroid conditions. See, thyroid problems are of plenty many types. But in today's video, I'm going to mainly emphasize upon 3 health conditions. The one where your thyroid is functioning less, that's a hypothyroidism. Second, when the thyroid function is more, that's the hyperthyroidism. And third, where your thyroid gland is inflamed, that's a thyroiditis. Besides these 3 thyroid conditions, if you have any other condition, which I may not have covered in my today's video, then you please write down your personal question in the comment box below. I will try to read and answer them as early as I can so that you can take care of your thyroid at the same time follow your fast routine. Alright, so let's begin. Very first question. Doctor, I have thyroid problem. Can I keep fast during Ramadan? Well, practically answer to most of the people is yes. But there are certain special population where they need to be extremely careful about the fasting. And what is that population? Why they need to be careful and what they can do so that they can observe fast, we are going to also cover in today's topic. Okay. So most of the time you can observe fast. Okay. Now, so we are going to cover the first condition, that's a hypothyroidism. What has happened here? Your thyroid gland is not functioning properly. Your thyroid functioning is less. So your body has a less T3 and a less T4 hormone. Okay. And a high TSH level. Okay. This is the main concern. And to treat this condition, a very commonly and very routinely prescribed medication is a levothyroxine. Of course, there is a set of population who take other kind of medications like T3 hormone or glandular extracts. But majority of the people consume levothyroxine medicine. Now, this levothyroxine medicine is available by plenty many different brand names across the world. Okay. To treat hypothyroidism, a very simple medication is used, that's the levothyroxine. As the treatment is simple, however, how you need to take this medicine is not that simple. There are special tips and tricks which you need to keep in mind while taking levothyroxine medicine. And what are they? I have made a detailed video on that. If you want, you can watch that video. You will have a more detailed answer on that. Okay. So levothyroxine is usually used for the treatment of hypothyroidism. More or less, people who have this condition and who are taking levothyroxine are aware that you need to take this medicine early morning on an empty stomach. Okay. This is feasible in a regular scenario where you are eating and drinking all 24 hours, where you are not observing fast. But when you are going to follow a fast like Ramadan, it becomes a little difficult. So what can you do in that time? I am giving you 4 options. You select which option is best suiting to you, and whichever option is feasible for you, you follow that during your entire fasting period. Okay, don't take one day this method and second day some other method, because by doing that your thyroid will further undergoing fluctuations. So what are those 4 possible options? First option, you can consume the levothyroxine medicine before suhoor. Yes, see, during Ramadan the people observe fast between suhoor and iftar. Suhoor is the first meal. Now, in a country like India, the suhoor timing is anywhere between 3 o'clock to 5 o'clock in the early morning. So, what you can do is that you can wake up and then do your prayer and then consume your levothyroxine medicine. And after consuming medicine, you can have your suhoor meal. Of course, for this, you might have to wake up a little 1 hour earlier than usually people wake up during suhoor time. But this is a one possible option. Many time it becomes easy for people to follow, but there is a set of population who find it difficult because they are not used to waking up such an early morning, and that's why they have a trouble. Secondly, because they are not used to wake up in the morning, suddenly they change their sleeping and waking up habit. Many people develop acidity, and for that they might need an antacid. And if at that time you are taking levothyroxine, again it's a problem. There are third set of people who completely avoid waking up at suhoor. They don't wake up at all. So if you belong to any of these 3 or you have any of these problems, taking the medicine before suhoor may not be feasible for you. It is feasible for quite a lot of people also. Okay, so this is a one option. So if this option is not right for you, then what you can do? Then you have a second option, is take this medicine at the time of opening your iftar fast. Yes. So what happens? You have fasted. Now it's the evening time. You have to take your iftar meal. So while you are going to take your iftar meal, prior to that, you just take this medicine with a glass of water, wait for 45 to 60 minutes and then have your iftar meal. Again, this option is feasible to quite a lot of people because they think that we have done such a long fast, it's 45-60 minutes, furthermore, it is not going to make much difference. So if you feel that, you can take this pill at that time. But there is a set of people who celebrate iftar fast with their family, with their friends, their relatives. And for this kind of people, iftar fast is like a more of a social and a family gathering. So if you have the entire family sitting and enjoying the iftar meal, and if you have popped up a pill and sitting alone on a side waiting for your time period to get over, it becomes a little social dilemma. People don't enjoy, people don't feel connected with their family. So if that is your problem, then you can avoid this. Otherwise, this is the perfect time you can take the medication. Okay, again, it depends on you and your lifestyle. Okay, if this option is also not feasible, then you got one more option, and the third option is take the pill 3 to 4 hours after your iftar meal. Again, quite possible. Okay, so you have taken your iftar meal, wait for 3 to 4 hours. So during that 3 to 4 hours, again, your digestive system will be empty. Understand, the levothyroxine medicine absorption occurs in our intestine. There is a part of our intestine, what we call it as an ileum, where the absorption happens maximum. In fact, when you are in a fasting state, the absorption of the medicine is nearly 80%. But the same medicine absorption comes down to 50 to 60% when you are not in a fasting state, you are in a fed state. So keep this point in mind. So after iftar, you wait for 3 to 4 hours. So again your stomach goes into the fasting state and you can take the pill and you will get the maximum benefit. There are a lot of people who find this perfectly fine. You don't have to wake up early. You don't have to wait during the iftar and spoil your iftar meal. You don't have to prolong your fast. So many people find it perfectly fine. However, there is a set of people who wants to eat every now and then after the iftar eating window is open. So if you belong to that category, this option is might be difficult for you or may not be applicable for you. Okay. Fourth option you have is that take the pill at the bedtime. Yes. So let's assume that you have opened the iftar in the evening, let's say around 7 p.m. Okay. And that was at 8-9 o'clock. Again, you have eaten something. Then you need to wait at least 3 to 4 hours before you go to sleep. You take the pill. So bedtime option is also quite feasible for a lot of people. Again, it depends on you which option works best for you. So you have these 4 options where you can take the medicine. Pre-suhoor, after iftar, 3 to 4 hours after iftar, and 4th is a bedtime. So these are the possible options you can take the medicine. Okay. One very important, you do not have to stop consuming the pill. Compliance is very important, and we see a lot of people stopping thyroid medication all throughout the Ramadan. Please don't do that, because by doing this you are going to fluctuate not only thyroid but many other hormones inside your body. So don't do that mistake. Okay. Now when we talk about this levothyroxine, the problem with this medicine is not only with the meal. The problem happens with the other medications also. Yes, let's say you have a thyroid problem. It may not be necessary that you only have a thyroid problem. There can be people who have a lot of other health concerns. People can have a psychiatric problem, people can have diabetes, blood pressure, cholesterol, and many other health conditions for which they might be taking other medicines. So what to do in that kind of a situation? So certain medicines which you need to avoid taking along with the levothyroxine, especially if you are taking any psychiatric medication. Okay, people take anti-anxiety, antidepressant. Please refrain that from taking the same time. Keep a minimum gap of 2 to 4 hours between the 2 pills. People take calcium supplement. People taking iron supplements for anemia. Again, you need to keep a gap. Okay, there are people who consume coffee. So again, you need to wait at least for an hour after you stop the levothyroxine medicine. Similarly, there are a lot of people who take a fiber. Now, of course, during Ramadan, the fiber consumption usually increases because people eat a lot of fruits and vegetables, and they drink a lot of water after the fast gets over. And because of that, their fiber content increases. So that can also hinder the absorption of the levothyroxine. So you need to be watchful for that. So these are the certain medications you need to be careful about. Not only that, there's the acidity pills. Now a lot of people, because they are not used to fasting, they develop acidity, and for that they take antacids. So again, you need to keep a gap between the 2 medications. So you need to keep all these points in mind when you take the levothyroxine medicine. Okay. So that's about the hypothyroidism. Now let's move on to other condition, that's the hyperthyroidism. Now hyperthyroidism, what happens here? Your thyroid is functioning more than requirement, you are having more T3 and more T4 hormone, your TSH is suppressed. Okay. To treat hyperthyroidism, medications are used like propylthiouracil, methimazole and carbimazole. So you see what medication you have been prescribed. With this medicine, One good advantage is that there is no problem with the eating or drinking. Okay, so the problems that we saw with the levothyroxine does not apply here. So if you are taking these pills, you can safely take it at any time during your eating window period. Okay, it's not a problem. That's why hyperthyroid people find it easy to consume the pill during this Ramadan period. But few points again here I would like to highlight. First, so propylthiouracil is a medicine which has a short half-life. And because of that, its duration of action is short, and that's why this medicine is prescribed at least 3 to 4 times in a day. So of course 3 to 4 times in a day may not be possible for you during the fast period. So what you can do, you can speak with your treating doctor, you can ask him to change or modify the medication if that is feasible. Okay. Second category of the people who are using carbimazole or methimazole. Now these medicines, because they were long action, they are usually given once or twice a day. So it becomes very doable, very practical, and their compliance is always maximum. So this is the second kind of medication you need to be careful about. Okay. Another point with the hyperthyroidism I would like to highlight is that hyperthyroidism people may not be always eligible to observe fast. Why? See, when you have a hyperthyroidism, probably you are newly diagnosed or your hyperthyroid is uncontrolled. And when you have an uncontrolled hyperthyroid, you have a lot of T3, lot of T4 hormone circulating inside your body. And this T3, T4 hormone is a highly metabolic hormone. And because of that, your entire body's metabolism is very high. And that's the reason why whatever you're eating, drinking, getting digested frequently. Okay, so people have a loose motions, people have diarrhea, frequent motions. Okay, people feel very thirsty. When your hyperthyroid is very uncontrolled, you can have a heart palpitations. Okay, tremors, all of these symptoms can happen. And if at this time, if you observe fast, you can land up in a major trouble. Yes, because your body is hypermetabolic, you are having a lot of dehydration. And if at that time, if you observe for a long period of fast, where even drinking water is not allowed, you are going to further aggravate the dehydration. And this dehydration can put a trouble to your kidney and also to your heart. So you need to be watchful for. So if you have a hyperthyroidism and if you decide to observe fast, first and foremost check whether your hyperthyroidism is well controlled, well managed or not. If not, if in the acute stage, you please discuss with your treating doctor whether you can observe fast or not. Plenty many times we have seen these are the population who land up in a major trouble during this fasting period. It not only disturbs your own health but also disturbs your entire family members. Okay. So please be watchful for this. Acute uncontrolled hyperthyroidism may not be right population to observe fast. Okay. Third category of the thyroid problem, which we usually see more commonly, is a thyroiditis, where your thyroid gland is swollen, it's inflamed, and because of that people have lot of symptoms. Now for your symptom relief, your doctor might prescribe you medications like painkillers or non-steroidal NSAIDs, what we call it as, or steroids or beta blockers. If you are put on any of these medication, you can safely continue them without having any trouble. Okay, so you speak with the doctor. These are the population can very easily observe fast and continue their medication. All right. Now coming to a very special population where you need to be extremely careful. First is the pregnancy. Yes, see, plenty many times pregnant women also wants to observe fast, and if they have a thyroid problem, you need to be extremely careful, because during pregnancy we want a very strict control of the thyroid. If your thyroid is imbalanced, continuing the pregnancy might be difficult. The outcome of the pregnancy might be difficult for yourself and also for your unborn child. So during pregnancy, we want a very strict thyroid control. And if at that time, if you do the mistakes of the medications and the problem happens to your thyroid, you are going to put yourself and your child in trouble. So during pregnancy, we usually advise not to fast, but again, it depends on you and your family decision and your personal health. But if at all, plenty many times what we have observed is after Ramadan fast, people usually have a high TSH. And especially if you have a hypothyroidism, in that kind of a situation, your doctor might increase your dosage of the medication. Again, depends on your individual case, and usually this is kept at least 2 to 3 weeks after the Ramadan gets over. Okay, so this is a one very special population. Don't take your thyroid very lightly during your pregnancy. Second population is the people who have a heart problem. Yes, so thyroid has a direct impact on your heart. So if you have a heart problem and if you have a thyroid problem, again you need to be very careful, especially if you have a hyperthyroid, because your thyroid, a high functioning thyroid, is putting a lot of pressure on your heart. And if at that time, if that gets disturbed, you can further aggravate your thyroid problem and your heart problem. So you need to be careful. The third condition is the people who have a other autoimmune. Other autoimmune, I would like to specially highlight a type 1 diabetes, which usually happens to children and young adults, where they need insulin hormone for the management of their diabetes. Now, insulin hormone causes a low blood sugar. And it is a time, if you are going to have a prolonged fast, you are further risking yourself to getting into low sugar, which can again be life-threatening. Fourth population is people who have a kidney problem. People who have a kidney problem, and if they observe fast, dehydration can further aggravate kidney problem. Not only that, especially if you are diabetic, uncontrolled diabetic, again can put up kidney problem. People have a lot of thirst, people have a lot of urination, again you need to be watchful for. Similarly, elderly men, if they have a prostate problem or if they have uncontrolled diabetes, further can have a dehydration problem. So you need to be careful about that also. Alright, so these are the special population for which when you have a thyroid problem, you need to be more attentive, more careful about your thyroid and your other general health, and you take a decision whether you can observe fast or not. Alright. So I hope after watching this video, you got some good and useful information which you can practically follow during your holy month of Ramadan. I wish all of you and every one of you very happy fasting and very happy holy month wishes to all of you. And if you like my video, please click on the like button. And if you are new to my channel, please don't forget to subscribe so that you get more and more useful information. If you have any of your personal question whose answer you are seeking for, write your question in the comment box below. I will try to read and answer them as early as I can. We will meet again with some new good and useful information. Till then, you take care of yourself. Namaste.